Hi everyone, in this video I'd like to discuss something about diabetes mellitus. It is a very common disease and sadly it's a very dangerous disease. If we just give a look in our family members or friends, we will find a lot of cases of diabetes mellitus. In fact, the Asian countries are having a huge amount of population that are diabetic. India is considered the diabetic capital of the world. Okay, so before I start with diabetes, I would like to tell something about the insulin. Okay, what is insulin? Insulin is a hormone that has been produced by the beta cells of the pancreas. Now, what is the function of insulin? Okay, what is the function of insulin? The function of insulin is that whenever we eat food, it contains carbohydrate. That carbohydrate is being broken down into sugar. This sugar goes into the bloodstream. From bloodstream, it goes to the cell. Okay. Now, the function of insulin is that to transport this sugar which is present in the bloodstream and make sure it enters the cell. This is the function of insulin. I'll repeat again. The function of insulin is to make sure that the sugar is present in the bloodstream that enters the cell. That's the function of insulin. Okay. Now, overall, if I say a basic classical symptoms of diabetes mellitus, there are four main classical symptoms. Okay. The first one, the patient will say that I'm hungry all the time. He'll be eating and eating. He'll be hungry. He'll be hungry a lot. He'll be very hungry. The second thing, he'll be drinking water a lot. There'll be a lot of drinking. He'll be very thirsty. The third one, he'll be urinating a lot. A normal individual will be urinating around 800 ml to 2 liters of urine per day. But a diabetic patient, he might go up to 15 liters per day. And the fourth one, there will be weight loss. Okay, I would like to make sure what I mean by weight loss. I like to focus in type 1 diabetes mellitus. Despite of eating a lot of food, still he'll be having weight loss. In type 2 diabetes mellitus, yes, he'll be hungry. Very less chance the weight will drop. Either the weight will increase or it will stay constant. Okay, so these four symptoms, please watch out. Even if you think you're normal, please watch out these four symptoms. You should not have these four symptoms. Okay, if you suspect, please go and check with your doctor. Okay, you need to do your blood test. Now, if I say how is diabetes defined, okay, diabetes can be defined as it's a clinical syndrome. Syndrome means it's having a cluster of signs and symptoms in which it is characterized by increased blood sugar. Okay, now what is the cause of increased blood sugar? There are mainly two reasons. Either the insulin production is not taking place, or the insulin production is taking place but the insulin is not working. Okay, these are the two main reason why there's increased blood sugar. Okay, so if I come down to type 1 diabetes mellitus, if I divide it in type 1 diabetes mellitus, mind you there are many types of diabetes mellitus: type 1 diabetes mellitus, type 1.5 diabetes mellitus, type 2 diabetes mellitus, gestational diabetes mellitus, and others. Okay, but I'm going to focus mainly on type 1 and type 2 diabetes mellitus. So coming back to type 1 diabetes mellitus, okay, it's an autoimmune disease. The immune system of the body is actually attacking the beta cell of the pancreas. That means there will be no production of insulin. I repeat, there will be no production of insulin. So if we see the patient, okay, the patient will be lean and thin. He will be like pediatric age group or young age group. And also he'll say that I don't have a family history. I don't know in my family who are likely to have diabetes. It is less likely that you'll be having a family history and have type 1 diabetes mellitus. Actually, people are shocked when they find out they are diabetic. Okay, type 1. They say, my father is not a diabetic, my mom is not a diabetic, my siblings are not diabetic. Why am I diabetic? And generally, type 1 diabetes mellitus, it's an incidental finding. it is found out like regular medical checkup. It is found out suddenly. Okay, so please understand, around 80% of your beta cell of your pancreas have to be damaged so as to see that there's increase in blood sugar level. Okay, so how do you diagnose type 1 diabetes mellitus? Actually, the diagnosis part will be done by your doctor. If I explain, it will be very long and very complicated. I want to keep it very simple. Okay, but if I want to say in one answer, he's most likely to do HbA1c along with other tests, but this is a very important test. This will give you a basic idea of average blood sugar level for the last 3 months. Okay, so once the diagnosis is made, and what is the treatment? Before I say the treatment, you should understand the pancreas of our human body is always releasing some amount of insulin all the time. But when we eat food, it releases in bolus amount of insulin so as to counter the sugar. But since the insulin is not working, okay, I mean the pancreas is damaged in type 1 diabetes mellitus, so we need to give it from outside. Okay, so if a person is eating food, all of a sudden he stops and he takes the insulin shot. He expects that he'll eat food immediately, but he is busy in some other work, or if he takes the shot and does not eat properly, will go in hypoglycemic attack. Okay, the management of type 1 diabetes mellitus is insulin pen, insulin given by outside, either by insulin pen or by insulin pump. Okay, please understand the hypoglycemic attack part here very carefully. If you don't eat properly your food and you take your shot, you will go in hypoglycemic attack. Okay, the insulin will be released from outside, and it will make sure that whatever glucose is present in the bloodstream to enter the cell. Since our body is very smart enough, okay, our body is very smart. If you don't take food, our pancreas will not release in bolus amount. But in this condition, we are giving it from outside. Our body can't help in this condition. Okay, we need a specific amount of blood sugar to be present in the bloodstream, but not in excess amount. If excess, it will damage the blood vessel and damage the organs. If we take all the blood sugar which is present in the bloodstream and put it inside the cell, we will go in hypoglycemic attack. Please understand the symptoms of hypoglycemic attack. You'll be having tingling sensation in your body. You'll be having fine tremors, like tremor. You'll be having anxiety. You'll be irritated. You'll be sweating. You'll be hungry. You will be able to hear your heartbeat, that is palpitation. Okay, so please carry a sugary drink or a substance with you. If you think that you are going to experience hypoglycemic attack with the symptoms, immediately take it. Okay, and always when you take your insulin shot, make sure you eat your food. Also, please carry a diabetic patch. It's a patch, it says I am diabetic. It's very necessary in case you collapse, you have hypoglycemic attack, and you are not able to take your food, you are not able to take your emergency, the sugary drink, or you might collapse, so that the bystander, it will be easier for them to identify that you are a diabetic and they should give you something sugary. Okay, now if I come to type 2 diabetes mellitus, there is production of insulin, but this insulin is not functioning because the receptor does not function. There is a problem in the gene. Okay, how will be the patient? The patient will be mostly obese, overweight. He or she will be saying that I don't go to exercise, I am not having a very physical activity. He'll say that I'm having a family positive history. Okay, his or her mother might be positive, having diabetes. Father might be having, brother, sister, siblings. A very good correlation in type 2 diabetes mellitus. Okay, and what is the management of type 2 diabetes mellitus? The management of type 2 diabetes mellitus is, please watch your carbohydrate intake. You need to eat food that are having low glycemic index and also reduce your carbohydrate intake. What are the foods that are having low glycemic index? Low glycemic index foods are multigrain atta, your oats, your brown rice. what are the foods that you should avoid? Sugary drink, beverages, chocolates, sweets, okay. And then after that the doctor will put you in something known as regular exercise. He'll advise you to do a lot of regular exercises. He will tell you to do a lot of walking or jogging. Please do not go to the gym, or please do not go and do a very strenuous activity, because most of the time people who are having diabetes, they're having some problem with their heart. So if you do a lot of strenuous activity, you might put a lot of stress into your heart. Please make sure you do normal walking or just mild to moderate jogging. How much you should walk? You should walk 30 minutes a day for 5 days a week, recommended by WHO. Even after these two steps, like maintain your reduce carbohydrate, regular exercise, and then also your sugar level is not coming to normal, then you will be put into drugs. These drugs will be mostly giving you metformin, but about this will be very well explained, and dosing will be very well made by your doctor. Another thing I want to make you understand, how will we differentiate is a type 1, type 2. In type 1 there will be antibodies formation against the beta cell. In type 2 there will be no antibodies forming against the beta cell of the pancreas. This is the only way to differentiate type 1 diabetes mellitus and type 2 diabetes mellitus, okay. So in overall, if I want to summarize, there are two types of diabetes mellitus which I am focusing on today's video, type 1 and type 2. Type 1 is caused by autoimmune causes. Your beta cells have been destroyed, and the treatment is mostly taking insulin from outside source. Please make sure that you don't go in hypoglycemic attack. And in type 2 diabetes mellitus, there is insulin, but the insulin is not functioning because the receptors are not functioning, and the management will be like control your carbohydrate, your regular exercises, and drugs, okay. And overall, if I say, please make sure that you go to your ophthalmologist once a year. If you are diabetic, he needs to check your eye. You'll be having complication in your eye, okay. And please wear shoes that covers, it covers your feet. Protect your feet, protect your toe, because in diabetes your nerves have been damaged, okay. It's on your nerves have been damaged. So if your nerves are damaged, if you get injured, you might not know it, you won't feel the pain, so there may be a chance of infection. That much you might have understood. You might have heard about diabetic feet or diabetic foot, diabetic toe. You need to amputate it, okay. So please make sure that you wear shoes that well covered, or wear slippers that actually protects your whole feet. And whenever you go to sleep, please inspect your feet, please, okay. And then maintain the advice, and please follow the advice that is strictly given by your doctor, healthcare professional. Do regular checkup, and if you are around 30-35 years or more, please do your blood sugar level at least once a year, just for prophylactically, and wear the badge. And yeah, that's it. You should know about overall of type 1 and type 2 diabetes mellitus. This is a very basic understanding of these two diabetes, type 1 and type 2. So if you have any questions, you may leave down in the comment section. I would try to answer. I would love to answer. And if you have any suggestion, please leave down in the comment box. I'd like to improve myself. And yeah, that's it. Thank you for watching, and yeah, bye bye, take care.